The NHS has a lack of funding, a lack of interest from the government and private companies milking the budget for all it's worth. But where is all that money going? A new report tells us exactly where. Almost half of a £2 billion cash injection promised for the health service in 2014 was spent outside the NHS. A new report by the Health Foundation for the Financial Times found that 900 million of that funding went to services from private and non-NHS providers. Are we surprised? Will the milking of the NHS budget and the sell-off stop at the hand of the Conservatives? I fear not. It has been proven time and time again. I have said on here many times, the Conservatives are dissecting the NHS. Now, I sifted through loads of reports in the past to highlight which MPs are taking donations in return for NHS contracts. They say they are increasing funding, but evidently they're not. Now, I live in Derbyshire and this is assigned to Labour. And thank God. The NHS here, Labour have invested £33 million in improving and building new care homes and day centres and spent over £200 million on providing care services to vulnerable people. Are the Tories doing that in their areas? I don't think so. They say they are, but the figures and the users of the NHS don't lie. The hospitals and doctors here in Derbyshire are a godsend. With social care, did you know the Conservatives had a 2013 plan to close 20 care homes? Now why? Why would you do that? Labour kept 18 of them open. So the government, promised the funds, then use the money somewhere else and then say to us people in the public, we're putting your council tax up. We're getting penalised for their greed. The Guardian reports that more than 20 hospitals in England have had to declare a black alert this week after becoming so overcrowded that they could no longer guarantee patient safety and provide their full range of normal services. Cancer patients are having appointments cancelled. Now that's wrong, isn't it? If Labour can do it here in Derbyshire, then why not in other areas? Yes, Derbyshire could be considered less people than the South, but the budgets should match the expenditure. Shouldn't it be, or isn't it, pounds for people? In one hospital, a birthing centre had to be closed, and we have all heard the countless amount of A&E departments that are being closed. Dr. Taj Hassan, president of the Royal College of Emergency Medicine, had this to say: these crowded environments are stretching the clinical workforce to their limits, and more importantly, at times, unsafe for patients. He urged ministers and NHS leaders to draw up an urgent action plan to rescue A&E care to avoid the quality of care patients receive are starting to deteriorate. Without dedicated funding and planning, both patients and staff will increasingly suffer, he added. But apparently it is understood that reports of an injection of emergency funding for A&E units are wide off the mark, a million miles away, and the Department of Health will not be producing any more money despite mounting problems. Now that tells me that the Department of Health says despite mounting problems, there will not be any more cash. They don't care. Here's someone that does care. This is what Corbyn and May said.
Last week, Mr. Speaker, 485 people in England spent more than 12 hours on trolleys in hospital corridors. The Red Cross described this as a humanitarian crisis. I called on the Prime Minister to come to Parliament on Monday. She didn't. She sent the Health Secretary. But does she agree with him that the best way to solve the crisis of the 4-hour wait is to fiddle the figures so that people are not seen to be waiting so long on trolleys in NHS hospitals?
Refers to the British Red Cross's term of a humanitarian crisis. I have to say to him that I think we've all seen humanitarian crises around the world.
Now, sorry to interrupt, but we're not talking about the world, we're talking about the UK.
And to use that description of a National Health Service which last year saw 2.5 million more people treated in accident and emergency.
Again, sorry to interrupt. Just because it saw more people doesn't mean it's not struggling. Doctors and nurses are heroes in making sure that everybody gets seen.
Than 6 years ago was irresponsible and overblown.
But can I ask her if she'll listen to Sian, who works for the NHS? She has a 22-month-old nephew. He went into hospital. There was no bed. He was treated on 2 plastic chairs pushed together with a blanket. And she says one of the nurses told her sister, it's always like this nowadays, and she asked a question to all of us. Surely we should strive to do better than this. Does the Prime Minister and the Health Secretary think this is an acceptable way of treating a 22-month-old child needing help?
Shameful.
I accept there have been a small number of incidents.
A small number of incidents? No. What I've mentioned in this video is a small number of incidents. There are thousands of incidents. And if they're unacceptable, why won't they increase the funding?
Where unacceptable practices have taken place.
And so it goes on. They know what they are doing and they know how to do it. It has to stop, and it has to stop now. Don't vote Conservative. We are the generation that needs to make things happen. Vote Labour. Everybody says he isn't a great leader. A good leader is only as good as the people who follow him. Let's just say he isn't a good leader. Let's just say he is shit. And I do tag Jeremy Corbyn in these videos. So if you are watching, it's just a theory. But if he is willing to listen to us and willing to do what we say, wouldn't you rather have a leader that does that, puts our changes in place, rather than have some suited and booted guy, all the airs and graces, looking the part, but manipulates the system to its own downfall and don't do what he is supposed to do, and that's listen and work for the public? I know which one I would choose. Every time. We want change. Let's vote for someone that is willing to do that. Why wouldn't you do that? Because united, we really can have a better society and a better political system. Have you had the benefit of the NHS lately? Share your positives and negatives in the box below. Get on board and make yourself heard. As always, click subscribe to keep up to date on this channel. Click the thumbs up. Thanks for watching, and I will see you again next week. Bye bye for now.